So first I want to say the spirit of dialectics, kind of what it is basically. In a way, that's even more important than grasping the 8 dialectical strategies. Because the 8 dialectical strategies are just manifestations of understanding the basic principles of what dialectics is. Some people are dialectical up the wazoo and they've never heard of a dialectical strategy. They just do it. So that's what the point. You know, like be the dog that I told you about, where you keep trying to do different behaviors. That's a dialectical strategy for when you're stuck and the patient isn't talking, but it's not on the list of 8 strategies, but it fits the spirit. So, what's the spirit? Why do we do dialectics? We create movement out of impasse. Impasse meaning stuck, meaning a logjam. Why do we do dialectics? To move from rigid emotions, rigid behaviors, and rigid thoughts to more flexible, more diverse, more realistic emotions, behaviors, and thoughts. When you're encountering stuckness, usually the stuckness is between 2 opposites. You might not know that at first. So you want to untangle the stuckness sometimes and then say, oh, this is in conflict with this. Patient wants out of the hospital, you want them to stay in. Patient wants in the hospital, you want them to stay out. You know, patient is not wanting to do this and you want them to. Patient is scaring you with some of the things they're saying and doing, but they don't want to take measures to reassure you. You're stuck, right? So part of dialectics, the function of it is to highlight, to tease out the opposites in a tense, stuck situation, so you can at least see the opposites and try to see the validity of both sides, rather than say, oh, this one's right and this one's wrong. It's to find that synthesis between the opposites. Those of you who do family therapy, it's just every session of family therapy. You've got this one saying this and this one saying that. This one's saying a lot, this one's saying nothing. This one's stubbornly stuck on this principle and this one's on this principle. And there you're just always, you are like my cousin in family therapy. You're just always poking, trying to get things to go from, you know, an equilibrium that's not going there anywhere to a disequilibrium that allows movement. Dialectics is a lot about creating movement, so you're finding the validity in 2 sides of a contradiction, and you're finding the piece of validity on both sides, and then you're trying to find a new way to think that includes both sides. Ultimately, the point of dialectics is to maintain a collaborative working relationship when you're faced with conflict and rigid behavioral patterns and impasses. You're just trying to keep it going. Movement, speed, and flow is a phrase used in DBT a lot among people who are trying to see, is this a DBT session? And they're rating the adherence to the manual. And they're looking for speed, movement, and flow. Like keeping going when things are stuck. I have this metaphor, actually, I think any of you who were at the workshop last year that I did, I think I told you this same one. So, you know, but it's helpful to me in more ways than you can imagine. I actually think of it. And it's the toy that our kids had when they were growing up that was about 2.5 feet tall, and it was a little plastic replica of R2-D2. Anybody ever have that toy? Wow, nobody had that toy. Maybe it was an East Coast toy, I don't know. But, you know, because other kids had this. And it's a remote control thing where when you turn on R2-D2, and he's like this, he's this plastic thing, and he has moving parts there, and he has legs that move. And he goes in one direction. So R2-D2, if I was up here, and I sort of think this is the essence of it in sessions to keep things going when you're stuck, R2-D2 starts moving when you turn him on, and he goes through your house, and he runs into a chair. He does this, and then he bounces back a little. Then he goes forward, and then he bounces back a little. But one of the times he goes forward, he may hit his leg first on one side, and it turns him a little bit. Now he's this. Now he's going back, and he comes back forward again. And now he's at this angle. Now he really turns this way, you know. And then he keeps going, and he actually gets past the chair. And then he runs into a wall, And he does the same thing. Actually, in one intensive training I did, I had everybody be R2-D2 in the room. So we had like 50 people going around being R2-D2 for 10 minutes and bumping into walls, corners, and getting stuck with each other. And one guy, it was really interesting, ended up in a corner and he couldn't get out. He just kept going, bumping here, and then he'd go there and bump there, and then he'd back here and bump here. And so we discussed things like that afterwards. We tried to put into words, how does that happen in therapy? Does that ever happen? And people came up with examples of, yeah, I've tried everything and I'm still stuck in the same little corner. So talked about that. But the R2-D2 metaphor sort of captures that you keep moving. And when you run into stuckness with your patient, you just keep moving. Patient doesn't talk. You try something else. Patient says whatever. You try something else. Patient has dissociated and doesn't remember anything. You analyze what came before the dissociation. You analyze what came after the dissociation. You set up mechanisms to help the patient be documenting what happens when they dissociate or have somebody else do it. You try different things. You make up things. You try your best solution, right? And so all these different things are ways, and partly it's just dialectical to keep going. Another metaphor for dialectics is jazz musicians, because jazz musicians are dealing with some pretty rigidly defined chord progressions and melodies, and they're trying to incorporate it into music, where actually, if you listen carefully to jazz, they really are these very solid, predictable, almost scientific numbers of measures and chord progressions and the sort of the melody that's going on and other things and certain types of chords that they use and others they don't. So it's kind of all, if you read a book on jazz, you have no idea what it sounds like. But then you hear it and you say, oh, I get it. And dialectics is the same way. You keep going and you improvise based on some of the things that are going on, and they all get woven together and you keep moving. And the themes are there. So that to me is the essence of dialectics. And